It's the jab that's now been given a much-needed boost. The drug, developed by the British-Swedish company AstraZeneca and Oxford University, is safe for use on the over 65s, and it can be administered in countries where new variants are circulating. That's according to the World Health Organization's Strategic Advisory Group of Experts on Immunization, also known as SAGE.
Even if there is a reduction in the possibility of this vaccine having a full impact in its protection capacity, especially against severe disease, there is no reason not to recommend its use, even in countries that have the circulation of the variants.
Many governments have been pinning their hopes on this particular coronavirus vaccine because of its price and its practicality. AstraZeneca has agreed to supply 40 million doses to the EU by the end of March, with frontline health workers in Berlin and police in Barcelona getting their first jabs this Wednesday. But it's not all good news for the manufacturer, with the government in South Africa suspending its rollout of the drug.
Their decision's been based on a very, very small study on the impact of the AstraZeneca vaccine on disease induced by the South African variant, but that disease is really mild disease. And looking at the difference between mild and severe disease is probably the area where there's a lot of confusion at the moment.
The WHO has yet to give the AstraZeneca vaccine emergency use authorization, but it is meeting next week to make a decision on that approval.